This is Plant-Based Briefing. Should we avoid oils for optimal health? Here's where top whole food plant-based experts stand on the great oil debate. Part 2 by Elizabeth Turner at forksoverknives.com. And I'm your host, Marian Erickson. This is the podcast where I curate and narrate with permission a variety of articles on plant-based and vegan living in about 10 minutes or less every weekday, but today's is longer, so it's a three-parter. I read part 1 yesterday, so go back and listen to that first, and then come back here for part 2, and then tomorrow for the third part. So now let's get to today's plant-based briefing. Should we avoid oils for optimal health? Here's where top whole food plant-based experts stand on the great oil debate. Part 2 by Elizabeth Turner at forksoverknives.com. Dean Ornish, MD. Dr. Ornish is president and founder of the nonprofit Preventive Medicine Research Institute in Sausalito, California, and clinical professor of medicine at the University of California, San Francisco. He is the author of 7 best-selling books, including Dr. Dean Ornish's program for reversing heart disease. His Ornish Lifestyle Medicine Program is a 9-week Medicare-covered program for reversing heart disease using a very low-fat, 10% of total calories, plant-based diet. How do you counsel patients on consuming olive oil and vegetable oils? Dr. Ornish, my lifestyle medicine program is based on science, which evolves over time as we learn more. It's remarkable how little my recommendations have changed since I developed and studied this lifestyle medicine program for reversing heart disease almost 50 years ago. In 1981, for example, I began recommending that people add 3 grams per day of algae-based omega-3 fatty acids to their diet based on new research at the time, documenting their many health benefits, which were initially documented by my mentor, Dr. Alexander Leaf, who was chief of medicine at Harvard Medical School at the time. I remember talking at the time with a group of dietitians who said, "You can't add oil to the Ornish diet." In that spirit, I used to preclude seeds and nuts because they are high in oils and fat. Several years ago, I became impressed with a variety of studies showing that regular consumption of nuts and seeds is associated with a reduced risk of heart disease and other chronic conditions. Consuming approximately 15 grams of nuts and seeds daily can decrease the risk of coronary heart disease by around 20%. This is about 3 to 4 small handfuls a week of unsalted nuts and seeds that are not roasted in oil. Especially beneficial are walnuts, almonds, flax seeds, pistachios, and cashews. While these benefits may come from nutrients such as omega-3 fatty acids, vitamin E, and magnesium, there is a germinative quality of seeds and nuts, life ready to burst forth, that we may have a hard time measuring, but may play an important role. Seeds and nuts provide a broader spectrum of nutrients than added oils, which are highly processed, dense in calories, and often inflammatory. Garth Davis, MD. A board-certified bariatric surgeon and obesity medicine specialist in Houston, Texas, Dr. Davis serves as medical director of Houston Methodist Comprehensive Weight Management Center. He is the author of Proteinaholic: How Our Obsession with Meat is Killing Us and What We Can Do About It. How do you counsel patients on consuming olive oil and vegetable oils? Dr. Davis, I discuss the fact that oils are not intrinsically bad, but they are calorie-dense. I recommend being conscious of the fact that they are calorie-dense, and so should be used cautiously. Do you personally avoid all added oils? I don't avoid oils at all. I love olive oil. I don't overdo oils, but I certainly don't avoid them. Monica Aggarwal, MD, FACC. Dr. Aggarwal is an adjunct associate professor in the University of Florida's Division of Cardiovascular Medicine, where she conducts research on the impact of nutrition in chronic illness. She is the co-author of Body on Fire: How Inflammation Triggers Chronic Illness and the Tools We Have to Fight It. Notably, Aggarwal co-authored the 2024 Recipe for Heart Health trial, which studied the impacts of olive oil and whole food plant-based diets in 40 adults at risk for cardiovascular disease. How do you counsel patients on consuming olive oil and vegetable oils? Dr. Aggarwal, I tell my patients there's no negative in having a little bit of oil, especially if you're on the leaner side, but don't be under the misconception that oil is good for your health. I tell people to focus on eating more fruits and vegetables, more beans and whole plant foods, because we know for sure that when you eat those foods, the fiber, the low saturated fat, you're going to do better. I think there's more data needed in the olive oil debate, but at this point, my feeling is we don't need olive oil or other oils for our health, but certainly there's no significant harm in eating a little bit of oil in your diet. Do you personally avoid all added oils? I eat a little bit of oil in my personal diet. I eat very clean, and I have a very good LDL, and I have a normal body mass, so keep that in mind. That's important. When I go out for a meal, I don't restrict the oil. When I cook at home, which I primarily do, sometimes I will use maybe less than a tablespoon of oil to cook 2 pounds of lentils. So very, very little oil in general, but I'm not afraid of a little bit of oil in my diet or my family's diet. Michael Greger, MD, FACLM. Dr. Greger is a physician specializing in clinical nutrition, a founding member and fellow of the American College of Lifestyle Medicine, and founder of the nonprofit nutritionfacts.org. He is the author of New York Times bestsellers How Not to Die, the How Not to Die Cookbook, How Not to Diet, and How Not to Age. How do you counsel patients on consuming olive oil and vegetable oils? Dr. Greger, the healthiest sources of fat are whole plant foods like nuts, seeds, and avocados. If people are going to use oil, I would recommend extra virgin olive oil, which is better than refined vegetable oils, and refined oils are better than tropical oils and animal fats. Brenda Davis, RD. Brenda Davis is a registered dietitian, speaker, and consultant specializing in plant-based nutrition. She has authored or co-authored 12 books, including Plant-Powered Protein and Nourish, the Definitive Plant-Based Nutrition Guide for Families. How do you counsel patients on consuming olive oil and vegetable oils? Brenda Davis, it depends on the individual. For those who are struggling with overweight or obesity or chronic diseases such as type 2 diabetes or cardiovascular disease, it makes sense to minimize or avoid oils as they are calorie-dense but nutrient-poor compared to whole foods like nuts, seeds, and avocados. To optimize the diet for effective treatment, it is best to prioritize whole plant foods over oils. On the other hand, oils can have a place in a healthy diet, as evidenced by many populations who include oils in their traditional diets, including all of the blue zones. For active individuals or those with high caloric requirements, good quality oils can help meet energy needs without increasing the bulkiness of the diet. Also, oils have value from a culinary and cultural perspective, enhancing the flavor, texture, and enjoyment of foods. Of course, the health effects of oils depends on what they replace in the diet. If oils replace animal fats, for example butter or lard, they are beneficial. Switching from saturated fats to unsaturated vegetable oils reduces cardiovascular risk and overall mortality. However, if oils replace healthier whole plant foods, less favorable outcomes would be expected. Whole plant fats contain protective factors such as fiber, antioxidants, and phytonutrients that extracted oils lack. Oils are energy-dense and lack fiber, making them more prone to passive overconsumption of calories. The bottom line is that vegetable oils can be part of a healthful diet when used appropriately, but fats from whole foods remain the superior choice for long-term health. Do you personally avoid all added oils? I minimize my use of oils, but do not completely avoid them. For example, I like to include a little sesame oil for flavor in a peanut sauce. I sometimes add a little oil to homemade cheeses for special occasions. I do not worry about oil avoidance when eating out, although I rarely eat out. The reason I'm not rigid about oil avoidance is that I view oil in much the same way that I view sugar. These foods are not poisons, but they are generally best minimized. We want most of our macronutrients to be intrinsic to fiber-rich plant foods. Of course, the health impacts of oils and sugars depends on their source and quality. Organic blackstrap molasses has more value than white sugar, just as fresh-pressed flaxseed oil has more value than highly refined soybean oil. Unlike refined sugars, which have little redeeming value, high-quality oils typically supply essential fatty acids, vitamin E and vitamin K, along with beneficial phytonutrients such as polyphenols in extra virgin olive oil. They also boost the absorption of valuable fat-soluble nutrients. My goals extend beyond human health to ethical and ecological issues. I want to see a mainstream shift toward healthy plant-based diets. I believe we will have greater success in achieving these goals if the diet is inclusive, honors cultural traditions, and allows some flexibility. We need to empower people to make healthy, plant-forward choices without creating barriers that may discourage consumers from embracing this compassionate, sustainable, healthful way of life. You just listened to Should We Avoid Oils for Optimal Health? Here's where top whole food plant-based experts stand on the great oil debate. Part 2 by Elizabeth Turner at forksoverknives.com. And I'm Marian Erickson, your host. Tune in tomorrow for the third and final part of this article, where we'll hear from Drs. David Katz, Alona Polday, Matthew Lederman, and Joel Kahn. So please share this episode with anyone who might benefit, and thanks for listening.